Hello, I'm Deborah Quilter and welcome to RSI Help YouTube. We're going to be talking about a very important healing technique that I've just discovered called instrument-assisted soft tissue mobilization. I was at my physical therapist and she whipped out these little tools and she started working with me, and I noticed that I felt a whole lot better afterwards. So I started investigating it and was lucky enough to find Dr. Nik Vizniak, he's the founder of the Professional Health Systems in Vancouver, Canada, and he's a real expert on this and has a lot of tools that I think he might show us later on. So welcome back to the show, Dr. Vizniak, and thank you so much for coming, and tell us all about Iastm.
All right, Deborah, thank you very much for having me. It's always a pleasure to meet up with you and go through and help educate people on this. As you know, one of my key things I love is education with all the books we write and everything else that we do. So instrument-assisted techniques have actually been around for about 5,000 years. But what we're seeing now is in Western medicine, we're seeing them becoming more mainstream in their utilization, not only for the benefit of patients, but also for practitioners. For a lot of practitioners, it winds up saving your hand so you can actually give and deliver better therapy for patients.
I know, a lot of massage therapists have come to me because they've been overusing their hands trying to help other people heal. And I think even physical therapists sometimes get into trouble.
Absolutely, you're absolutely right. If you look at physical therapists, this is a great stat from a study back in 2016, I think it was. Physical therapists who do hands-on techniques actually miss work approximately 3 or 4 times a year due to thumb pain. Well, that thumb pain is significant for anybody. Massage therapists in the US, typical average lifespan in practice is about 5 to 7 years, and it's because you're working in small joints. It's a repetitive strain injury for practitioners is what you're looking at. Now, as a patient, it allows you to get in and be much more specific with the tissue. And this is something we were talking about just before we started up the video session right here, was that a lot of patients will tell you they want deep treatment. Well, that means a lot of loading on the practitioner who's loading in there, and really what they mean is they want specific treatment. They want to actually load in and be ultra specific with that. Instruments allow you to do that where your hands cannot approach that type of specificity of contact on a patient.
So I noticed that some of the instruments are shaped differently. Can you talk about how that works?
Oh yeah, absolutely. When I was first getting into this, I didn't even realize it. I'm like, oh, is this really going to work? Is it going to really make that much of a difference? It is a game changer. So I'll just go and I'll be off screen for just 1 second. I'll just grab a set right here. If you look at the wall behind me right here, you can see that we have the largest collection that I'm aware of in the world, over $50,000 of instruments right there, from all kinds of different companies that are available. Some of them are over $1,000 an instrument. And at the end of the day, we sampled all of these. We went around the world and bought as many instruments as we could, and we developed our own instruments. And if you look at the shapes, they're designed to emulate shapes of your own body. So this is one that we've developed right here called our ProStim TriStar. And if you look at this, that is literally the shape of my thumb. So now instead of me having to load in with my thumb, I can load in with this instrument and reinforce beside it and kind of still get my good tactile sense, but I'll get ultimate load where it goes through the palm of my hand, saving myself that repetitive strain injury, right? This edge right here is exactly a knuckle. Most patients and practitioners who use these, and there are thousands and thousands of them now that are using our instruments, this edge right here is perfect for up and down the spinal laminar groove, up and down the erector spinae in your back. And when we do our CE courses, when people see the real anatomy, what it looks like, you realize how limited your hands actually are and what a difference these things actually make on a patient's outcome.
So how does it actually work? Sometimes I feel like my physical therapist is flossing, for lack of a better word, flossing my tissues.
Yeah, okay, it's not a bad word to use. There's a bunch of different ways you can look at this. The first thing to get is that it works by, number one, stimulating your nervous system. Simply dragging this over top of the skin and working through the soft tissue stimulates neurologic response. What else happens? We also get a reflex hyperemia. This means you get more blood flow into the area. And if we know one thing that's involved with healing, it is directly related to blood flow. If you want to see more specifics about this, we have a YouTube video up. It's probably one of the most popular ones on instrument-assisted techniques. If you just go onto YouTube and type in, what is Iastm, or Vizniak, what is Iastm, you'll see a video where we show a computer graphic of what it theoretically does. We show a cadaver dissection of it, and we show application on a real patient, so you can see how it's actually working and the specific changes that it does. But again, for patients, even the smallest part of me that could push in and actually work on soft tissue is my pinky finger. There's no way that I can be as precise as an instrument like this to actually sink in. And again, saving my hands while I'm doing it. It is a night and day difference for the patients and the practitioners who use it.
And how does it actually work? As I understand it, you're clearing up soft tissue scarring. Is that
Well,
correct?
there's a big controversy and debate around that. The older information talked about breaking up adhesions and decreasing soft tissue, increasing soft tissue flexibility. One of the things that you are seeing in a number of studies that are out there is you do see increased range of motion following treatment. Now, whether that's due to neurologic stimulation, increased blood flow, or actually physically lengthening the tissue, any one of those mechanisms are plausible. The research is still out on the specific mechanism of what's going on. For most patients, though, the first treatment winds up being a little tougher for them to actually handle as you're working through the tissue. Then you can load in with a little bit more the next time. And by the third treatment, you are actually able to see much better results, deeper tissue work, more specific work. I mean, if you want to understand how good this stuff actually works, you know yourself from having done it. I am a doctor who now treats mostly other therapists. And so when I treat these therapists, what are they asking for? They're asking for a detailed assessment, but they're also asking for instrument-assisted techniques so they can learn themselves to apply them and to see how quickly it makes their body better. If you really look at it, if I use my hand to push on you, this would be about whatever the size of my hand is in square inches. And I can go ahead and use an instrument. I can be so much more specific and higher dosing over a shorter amount of time. It really decreases the healing time required for the actual dose and treatment response we get for most of our manual therapies.
I was surprised that it doesn't hurt, at least the experience I've had. I'm not a big believer that painful treatments are useful. Sometimes I think they just create more pain.
You're absolutely
But
right.
it was, it's not unpleasant.
No.
And what surprised me was how much better I felt. And you know, I don't I see my physical therapist on an as needed basis. I do a lot of work on my own to take care of myself. And so I don't know, I mean, how do people gauge how many treatments they need, or do they need more in the beginning, or how does that kind of work?
So it always depends. You need at least one treatment and then a follow-up to see how you're going to respond, because everybody responds a little bit differently. And it's the same for any treatment that's given to anybody, anything from medications to surgeries to any hands-on treatments. Every treatment has to be individualized for the patient. So part of this is almost exploratory for some people. Some people, you use it at the very start and they feel great. They're ready to go for the next visit, all excited. Other people are like, whoa, I felt like I got hit by a bus after that first treatment, because it had such a profound response within their body when you give them those treatments. So first treatment, at least 2 treatments are required. The other thing is, because the dosing response is so much higher, you really have to give yourself more time to heal, potentially, varying on how hard you're actually working with the patient. So if I have somebody who is, let's say they've been treated with this before, they're a CrossFit athlete, fairly muscular, very well-built person, the treatments are going to be quite a bit more intense than somebody who is, you know, geriatric patient population, relatively light dosing, see how they respond. As a general rule, for all the seminars that we teach, you always want to start light and then gradually increase your dosing based on what the patient can actually tolerate.
Well, it sounds like if you're going to try Iastm, it's good to give it more than one session so that you can adjust the dosage and not immediately write something off if you do feel that you had.
Absolutely. You're absolutely right. And anything else that you do too, it's like anything else, you should sample around different practitioners. If you look at a lot of the therapies that are showing up on YouTube, you're looking at treatments that look like this, okay?
Mm-hmm.
That's great if my goal was to abrade your skin and stay nice and superficial. But really, if my goal is to get deeper into the tissue, start separating through muscles, or even more so, separating out through different tendons and working in very specific regions, then I have to actually take a slower stroke rate, get in deeper, and then have that good communication with your patient. Let them know more pressure, less pressure, working right in here. Like I said, I treat a lot of therapists and doctors. The reason they come into me is because we can actually get results and show them the kind of limits that they can work to that a lot of people are a little bit short on. If you follow me on Instagram, I posted, and this is crazy, don't try this at home, kids. I posted a little bit for some neck work. Well, if you look at your neck, a lot of people with whiplash, they actually have an issue with longus colli, which is a deep muscle in the back of the neck. And a lot of people believe you can't palpate that or you can't reach it, which you totally can. And even with instruments, you can take and you can move your esophagus out of the way, and you can sink in and get in on that anterior part of your cervical spine, a structure that people believe that you can't reach or is difficult to reach. And I can be way more specific with it when I do that. But again, you've got to find the right practitioners who have the right education, who can help you reach these ultimate outcomes right here and work in these deeper tissues that other people may not have the skill set or knowledge base to reach.
You know, I'm glad that you talked about the relationship between the patient and the physical therapist and saying, you know, how am I doing here? Is this too deep? Because I think a lot of people make the assumption that the therapist knows best and doesn't realize that it's good to have a communication where you're saying that feels a little strong to me. Could you lighten up a little bit?
Yeah, you are absolutely right. If you were looking at all the outcomes, I mean, I've written now, we're on book number 14, I think right now, all the outcomes are better with open communication with the patient and a patient-centered approach. There is no healthcare without the patient being the center of that process. So their opinion, their mood, anything that they're feeling is 100% valid for them to share. And we need to respect and work within that limit as part of the patient's requirements. Like, don't get me wrong, you're going to hear me say, oh yeah, every treatment is wonderful and everybody gets better. If the practitioner is being honest, that is absolutely not the case. There are times when I've had patients that are, nope, this was too much for me, I just can't handle it. And then we find alternate ways to go ahead and treat a patient, okay? But again, you can lighten up the loads, and there's lots of different ways you can still apply instrument-assisted techniques for repetitive strain injuries. But again, you've got to work within the limits of the patient.
And in terms of how it helps, as I understand it, it reduces scarring and allows the tissues to move more freely. Is
Absolutely. And what I'll do for patients, so that's what it really does, is you make your you make your tissues more fluid. One of the things that I'll often do for a patient is we'll treat one side of their neck, we'll have them lean their head to the side and say, how does the opposite side feel? So you have a direct comparison between treated and untreated, and to a person, they will say, it feels stuck this way, it doesn't want to move. This way feels smooth, it's more fluid, and they'll have more range of motion in the opposite direction. You apply this principle to every part of the body, shoulders, arms, legs, abdomen, low back, whatever it is. You can show a patient results that stick. They'll be there for the next day and the day after in most cases, following visits. Okay, so you show them results that actually last.
I have found it to be useful as a maintenance program.
Yeah, absolutely. Yeah, and especially
I keep going.
The more scar tissue formation, even as you start to get older, like, let's be serious, none of us are getting any younger here, right? One of the major signs of aging is a loss of flexibility. These instruments are a great way for you to maintain flexibility and overall range of motion to keep yourself physiologically younger.
And typically, how long do the treatments last? 30 minutes, 45?
It depends on the practitioner. If you were in to see a massage therapist, you'd have a standard, or physical therapist who was doing more massage, you'd have a standard 45 1-hour visit where they'd use their hands a lot. Instruments would come out for a little bit and then hands again. A lot of chiropractic treatments, it depends what somebody's coming to see me for. If it's a relatively simple case, we can even be 5 minutes, 10 minutes of treatments with one of the instruments that actually works out to be the equivalent dose of like a half-hour, 45-minute treatment. But because you're working so much more efficiently, working smarter, not harder, you actually see a better response rate with it too. So it varies 100% on the practitioner.
That is so interesting. I was just thinking that I bet a lot of professional sports players are interested in this.
Absolutely. Yeah, 100%. Like, as you get into more and more elite function, I do seminars for professional sports teams as well. And these guys, all the trainers and therapists there, what do they want? They want the most elite, cutting edge. How can I get my players better, faster? This has got to be there for every professional sports team. And most of them are actually using different forms of instrument-assisted techniques.
Well, what I like the best about it is that it's effective for the patient, but it also spares the hands of the practitioner.
Absolutely. It's a win-win.
I mean, I think that's just brilliant. I mean, it just makes sense that you don't want to be injuring your hands trying to help someone else.
Exactly. How can you help somebody if you're injured yourself, right? I dislocated a shoulder about 4 years ago, and that 6 months in practice wouldn't really take that long, but there was definitely modification of techniques that I had to use because of that injury. You want to avoid injury at all costs. And just like we're talking about here with the repetitive strain YouTube channel that we're creating here, is as a practitioner, they are at the highest risks of repetitive strains because they are doing day in and day out hard work on joints that are not designed to be weight-bearing joints, yet they're pushing and working with these joints all the time. So It's a win-win for everybody. Patients get better faster, practitioners save themselves and help, and are able to help more people.
Now, one thing you said earlier, I think this might have been on your video, that you pull rather than push. Am I
Yep,
remembering
absolutely.
that?
So if you look,
So that's easier.
yeah, if
Talk
you look
about that, Nik.
yeah, if you look at a lot of treatments or anybody who's got repetitive strain injuries, well, what is it? It's from a repetitive action. That means literally, if I'm a massage therapist, what am I doing? All day, I tend to be pushing through the tissue. Elbow comes in, pushing through the tissue. All those actions are taking place, but it's really easier for you if you actually push a little bit and then pull a little bit. Change the actions around. Change how you move a little bit so you can actually change the forces on your body and separate those out into different tissues. When we do our classes, I don't have this, but we show thumbs of different practitioners. And you can tell after about 5 years in practice, if somebody likes to use this thumb all the time, what is it? It's shorter, it's wider, and it aches almost to a person.
Yeah. Yeah, I did a very interesting segment on the thumb with a doctor who's a real expert in this, and boy, oh boy, do you have to be careful of your thumb.
This is what allows you to do so much in life right here, and this is what you're trying to save. Absolutely. Yeah.
Yes. Well, thank you for this education about Iastm. I'm really excited about this, and I'm assuming that if there's any practitioners out there who are interested in enlarging their skill set, they could come study with you or find a way to learn about Iastm more.
So what we have online seminars that people can take. We offer in-person seminars about 4 times a year as well. There's lots of opportunity for people to find information on this. What we do differently than anybody else, though, is we are not proprietary. We actually let you try all of these different instruments out so you can make your own informed decision. What happens for a lot of these companies is they only let you try their instruments. That's it. They're the best. No. We know that ours are good. You know your instruments are good when you can say, hey, try everything else, and you make an honest choice with that. So that's what people can do. They can find us online at prohealthsys.com. They can go ahead and just YouTube search Vizniak because it's a distinctive last name. You can find it that way. Or they can find us through our textbooks as well on anything from anatomy all the way up to advanced orthopedic assessment.
You know, I do the same thing when I'm doing ergonomic assessments. I don't have one now, but I used to have an ergonomic playpen. And I'd bring in all the tools that I felt were the best keyboard, the best headsets, the best, sit stand risers, the chairs that I liked. And I would bring in all those things and let people try it, because you can't tell. Things are shrink wrapped. You don't know what they're going to feel like for your hand. Totally. So I felt like it was a more honest approach, and, let people play with this stuff, because usually they would know instantly, this one feels really good to me. And everybody's hands are different.
Exactly. That's exactly it. Anatomical variation has to be out there. And what I find is you think you go to see Dr. So-and-so because they know so much about it. All they know is what they've seen. They've only seen one instrument, so they claim to be an expert on it when they really haven't tried out multiple other versions of these things to really make an educated call on it. It's just like when you do evidence before you write a book or do a literature report or anything like this. You've got to look at what's out there and then make an informed decision, not just put the blinders of bias on where you can only see, oh yes, this instrument is the best because it's been around for I don't know how long, kind of thing, right? So
yes. Well, thank you for removing the blinders of bias for all of us today. Thank you so much for coming on the show, Dr. Nik, and I hope to have you on very soon for another informative episode of RSI Help YouTube. Right. So thanks for everybody for watching, and please subscribe.
All right. Thank you very much. Good stuff.